Figuring out the best solution to bring the pandemic to a halt.
Health experts are now weighing in on how we can stop the COVID-19 virus as it mutates. Among the ideas being floated, approving a new booster vaccine. Wait News health and medical reporter Veronica Marshall spoke to the experts to see how long it will take.
The UK variant is already here.
We will see B117 related hospitalizations, and then we will see deaths to follow.
The South African and Brazilian coronavirus variants are right behind it.
Vaccines, however much we scale up distribution, it's not going to be fast enough to address the problems of variants by itself.
Dr. Atul Gawande says we also need to test more samples to discover variants and create more COVID-19 drugs and treatments. Scientists are already working on booster shots to improve vaccine efficacy.
The FDA is in the middle of coming forward with a process that I expect to see in the next week or two for approving new boosters.
If it's as simple as using a third dose of vaccine to get a stronger response against the variants, then we're in a good place.
Another option, updating the vaccines themselves to include more strains of the virus, like the flu shot. If manufacturers go that route, Dr. Kartik Cherabuti says it could take just a little longer.
We'll have to do a few studies. You don't have to go to the complete process, but it still need to be studied.
The mRNA vaccines, and those can be relatively rapidly updated to add the new encoded genetic variants,
allowing us to adapt and overcome. Veronica Marshall, Wink News Now.
Dr. Gawande, who was part of President Biden's COVID-19 advisory board, says adapting the vaccine isn't enough. He says we also need to increase access to clinical trials to get them out to people faster.